guys, so I'm back. So, as some of you know, if you watched some of my previous videos, I got a breast augmentation November 3rd of this year. So, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So, about 2.5 weeks post op. I went to Miami the 31st of October because my appointment was set for Monday. Surgery was scheduled for Tuesday, November 2nd, and I went in for my appointment, 7:30. Everything checked out, whatever. COVID test was done, urinalysis was done, everything was great. I had submitted my paperwork, like my EKG results, my lab work, all that stuff prior, like about 3 or 4 weeks prior. They had cleared me, said my doctor had also cleared me. So everything looked great. Anyway, I got there for my post-op on November 2nd. I went with Seduction Cosmetics. Dr. Amarante was my surgeon. November 3rd, I was scheduled for surgery, and I went in. They told me to be there at 7:30 a.m. because I was scheduled to be one of the first patients for surgery. So I went in. I started fasting the night before at 9:30, so I was like super hungry. But I went in at 7:30, and I waited for like 2 hours to see my surgeon. So he never came in, and finally about I gowned up, was ready for surgery, was ready to go, was pumped up. And one of the medical assistants came in and told me that my surgeon was a little bit worried with my EKG, even though they had cleared me like 2 weeks prior. So I was confused. But she said that he had seen like maybe like a little abnormal reading on my EKG. So he wanted me to see a cardiologist for clearance. I was a little upset because it's like, you're now telling me and I'm literally here for surgery. So anyway, they were able to refer me to one of their cardiologists. Thank God, because here I am from Ohio all the way to Miami, and it's like, I don't have my cardiologist here. So they actually had a cardiologist that worked with them. So they were able to get me in to see them. My doctor wanted an echo done and another EKG, and said that I was good to go for the following day for surgery if everything came out fine. So I went to see the cardiologist there, and luckily they cleared me, and I had surgery the following afternoon. So as you can see, I am 2.5 weeks post-op. And by the way, I'm missing a nail on purpose. The day of surgery, they have to put a pulse ox on you, so they can keep your vitals in check, or your pulse and your whatever. So I had to rip one of my nails off quickly, so they could put a pulse ox on me. So if you guys have surgery, either don't get nails prior to surgery, or you have to take one off. So I gotta get them fixed. They need filled anyway. So anyway, yeah. Story why my nail is missing. So anyway, surgery went well. My surgeon was really, really good. I had seen some other surgeons, had some consultations with them, and they were not willing to give me what I really wanted. They just didn't know if, what I wanted in CCs would actually fit my frame. I knew what I wanted, so I'm like, okay, well, if you're not going to give me what I want, then I'm going to go elsewhere. So that's how I looked into Miami. So my surgeon was Dr. Amarante through Seduction Cosmetics. I had done a lot of research with him, and I liked his work. So Seduction Cosmetics gets quite a few negative reviews. But what I researched with my surgeon in particular, I really liked him, and I saw results, and I saw a lot of, afters, before and afters, and I was really happy with him. So he was really good. I wanted 700 cc's. Originally I was going for 800, but I'm like, I don't know. I'll just go 700 because I'd done a lot of YouTube research. I'd liked, you know, I'd seen a lot of the girls that had maybe went with what I went or close to, and I really liked their results. Um, you know, every surgeon's different, so you always kind of like, I don't know. I don't know if I want to go that big, or maybe I should have went smaller, but I knew what I wanted. I was looking for bigger. I think I had like went down to a B. I used to be a C, like a big C, but then I had kids. I have 4 beautiful children, and then I also lost 85 pounds this year. So yeah, my kids did a number for me. My 4th child made me gain like 50 pounds, and I'm really sure I'm only 5'2", so I'm like, okay. So I lost 85 pounds, and my boobs just deflated. They deflated, they had no mass, they had nothing. One was bigger than the other. I just wasn't happy, you know, and after breastfeeding, I mean, especially 4 kids, you kind of like get a beating to them. Moms out there who know what I'm talking about, okay, you know what I'm talking about. So anywho, my boobs had deflated. So I knew what I wanted. I wanted 700 cc's. He started fitting me for like 450, 550, still wasn't happy, 650, and I got down up to 700, and he's like, so that's what you want? I said, yes. So that's what I got. Overall, I'm really happy with the results. Like I said, I'm like 2.5 weeks post-op, and you know, I love them. They're healing really well. I took a shower today. They put surgical tape around my nipples because I got a breast augmentation, gel implants, and I also got a breast lift. So my incision goes from here, then it goes up, not very far, and then he, you know, lifted up my nipples. And you know what? The incisions look great. They look fantastic. I just removed the tape off today. They had initially told me that I could take the tape off. So they had tape around here, and then tape down here, and then tape down here. They had told me that I could take my tape off like 5 days after surgery, but I'd also heard that it's good for the tape just to set for as long as it sets before, you know, whatever, let them fall off themselves. But my tape was really on stuck, and they were still on today. And I called my doctors, and the pre-op, you know, nurses told me that I could remove it. Get them wet, get them, you know, put some alcohol prep on them, and you can just take the tape off themselves. So fortunately, it all worked. And I was so happy. I was scared, trust me, because I'm like, if I want to take it off, or my incision's gonna open, or whatever else. But fortunately, they came off, and I was really happy. So I usually wear my compression bra, and I've had some like padding and gauze underneath just to cover up my incisions. But as of today, I'm just, I took my training bra off just to show you guys what they look like. Like I said, I am really happy. This boob here, breast, took a while for it to drop. And I was a little worried after like 5 or 6 days a week that they had dropped a lot. I usually wear my band, my surgical band. They'll give you a surgical band, you know, post-op. And you have to wear it like around your chest, it velcros. And I wore that for like the first week. I've been wearing it actually. I took it off this morning just to kind of let my breast breathe. But anyway, it's supposed to push down on your breasts and help them drop. So this one is looking really good, like much better. This was actually the smaller one from this one before I got surgery. So he was able to make them really proportionate, I think. And overall, I'm really happy with everything. So my incision is like down here, you know, like you can see it. Like I said, I've taken my tape off for the first time. And like I said, I'm overly happy, like overall happy with it. Like right there. Can't go all the way up because my nipples are there. So I will post another video with like little tapies on so you guys can actually see the full effect. But that is what they look like. Like I said, I got the breast augmentation with gel implants and a breast lift. So anyway, overall, my surgery went well. My post-op was a little rough. I think it's because, I went a little big, what I wanted, and I had the breast lift. So both of them, kind of like takes a toll on your breasts. So, post-op, we stayed down in Miami for like 7 days following surgery. They wanted you to stay for that amount of time so they could, have your appointments. I got 3 massages from the clinic. Yeah, I did have to pay for them. They were like $100 for an hour each. So it actually helped. They recommend you getting your breasts massaged, help it bring it down. I also bought a cream. Goodness, I forgot to like bring it, or it's in my bathroom. So anyway, they give you some you have to buy it. I bought it for $100. You get surgical gauze. They give you a bottle, really big bottle of cream. So you can put it on your breasts. So it helps you with your breasts, tissue. I mean, you can get stretch marks, especially if you go this big. So the cream they gave me allows my skin, it can stretch, and I don't have to worry so much about getting stretch marks. The package also included some massage oil. You can just massage, on your breasts and, get them all oiled up again to help you keep your breasts looking well, and so you don't have to worry about or don't have to worry as much to get stretch marks. So I've been using that. I actually apply that every day. I don't see any stretch marks. I don't see any. My skin looks amazing, and it feels amazing. So I usually put that on after a shower, put my surgical bra back on. I wear my band most of the time. I take it off to breathe once in a while because it's kind of uncomfortable. Overall, I was a little sore. Actually, I was really, really sore. The first few days was pretty tough. I kind of walked kind of like with hunch, and I just, it was painful. Luckily, my husband and my children came with me, so we stayed in the hotel for like 7 days, and was able to kind of get help afterwards at my post-op appointments. So he helped me shower. I have to sleep sitting up. I don't know when I can actually lay down on my bed. Right now it's still kind of painful, especially when you want to get up. He does help me, so that helps a lot, but you're not really supposed to lay down flat or on your bed because your breasts are still healing and you don't want to shift on your side. And I'm a side sleeper, so when I try to get on my side, it presses against my breasts, and it kind of hurts. And I start getting shooting pains, where your nerves, they're under there, under the muscle, and your nerves get, they're not expecting to get a lot of work done. So, hi, sweetie. So, anyway. So I haven't laid down on a bed. I've tried, but it just doesn't work for me right now. So I'm still sleeping on the couch, sitting up, and my husband props all these pillows behind me and beside me, so I can kind of hold my arms up like this, but it helps. So hopefully within the next week, maybe sooner, I can actually lay in my bed with my husband and feel comfortable. As of right now, movement-wise, you're not supposed to lift your arms too high, especially after surgery, like a week or two. You're really not supposed to lift your arms up because if you do, or lift heavy things, you can shift your implant all around, and it's going to pocket in that area, and you might have issues. You're going to have issues. You're just pretty much going to dislodge your implants, and you don't want to do that because it's not good. Here you paid all this money, and you've just dislodged your implant. So you don't want to do that. Like I said, I'm like 2.5 weeks post-op, and I'm actually starting to be able to raise my arms. A little bit of discomfort the higher you get, but I'm getting there. I don't lift things. Lifting things is still pretty heavy. I mean, like, I'm not supposed to lift like 5 pounds over, like 10 pounds over. I want to say 5 pounds is what my surgeon told me, because I kind of went bigger. So I find myself kind of trying to like test some things, and it's just not comfortable. So I'm not even going to do it. You don't want to, pop your incisions open, and you don't want to like damage your breasts. So I don't do that right now. I also work in the medical field, so I actually plan on taking about 4 to 6 weeks off. My surgeon recommended me 6 weeks, like minimum. If I needed 8 weeks, that would even be greater. So I took like a month and a half off. Luckily, I actually made my own schedule. So I work for an agency out of Boston. So that actually works well. So I just basically don't have to answer to anybody, and I make my own schedule. So that's good. I'm hoping to go back to work in a couple weeks. Not sure if I'm going to be there, because I kind of like work patient to patient care, and consists of a lot of lifting and transferring, and all that stuff. Charting wise, documentation wise, easy, because I can just sit there and like document, computer or whatever. But I do a lot of patient to patient care. So we'll see how that goes. Other than that, like I said, I'm overly happy. Like I said, I went 700 cc's. So yeah, you guys, this is what that's what they look like. Like I said, everything looks good. Hopefully everything continues to look good. This is what they look like to the side, as you can see. He did a pretty good job proportioning. So anyway, yeah. So if you guys have any questions, or maybe I missed something, go ahead and let me know down below. I'm willing to answer any questions you guys may have, and I will keep you guys updated on my recovery. So like I said, fortunately everything's going great. We'll see how the next couple weeks go. I will keep you guys updated. And I'm looking forward to summer, so I can show these babies off. I can show them off now. My husband loves them, and he's like, you can show them off anytime you want in the house. So, anyway, this is where I'm at. And like I said, if you guys have any questions, let me know. I'll try to answer all of everything that you guys have to ask, and I will keep you guys updated. All right, thank you so much for watching. Please hit the subscribe button below, and we'll keep you guys updated. Oh, and one other thing, you guys, I'm doing this video just to show you guys my results. I'm not in any way condoning, surgery for you guys. Be safe, do your research, and make sure you know what you want. This is every woman's choice. If you want bigger, you go bigger. If you want smaller, you go smaller. Everyone's different. And it's basically, do what makes you happy. So that's what I did. So, I don't do too much stuff for myself, and I'm a mom, I'm busy, and I just said, you know what, I'm gonna get them done. So anyway, do what makes you happy, be positive, and just do it. Everything will be fine, and I'm sure you guys will like results just like I do. So you guys go and do you. And if you guys have any questions, like I said, ask me or comment below, and I will get back to you guys. All right, thanks for watching.